and welcome to the Senior FYI. My name is Debbie Pesca DiGiulio, and today I have the pleasure of introducing our new Director of Public Health here in Revere. Her name is Lauren Buck, and Lauren, welcome.
Hi, thank you so much for having me. Glad to be here.
Well, I'm glad to introduce you. I want our seniors to meet you and hear a little bit about you.
Yeah.
First, we can start with your education. I know I see the University of Miami sticker on the back of your car, and it's unusual to see that in Massachusetts. So give us a little history of where you've come from.
Sure. So I grew up in Maryland, actually. That's where I spent most of that's where I grew up before I went to college. And then, like a lot of people, I had this vision of going to the beach, right? And so I went down to University of Miami for 4 years for college, and got my nursing degree there. So my background is I'm a nurse, and I've been a nurse for about 10 years now. And so anyways, when I was getting my education at Miami, loved it. It was a great experience, but I realized that I was someone, probably unlike a lot of people, who really liked having seasons. Also, a lot of my family is up here in the Northeast. So came back after I went to school there and I got my nursing degree, and I actually ended up after college kind of living out a dream of mine to live in New York City, which I was able to do for about 5 years. So my first my first nursing jobs were in hospitals in New York City. And I got a lot of experience in terms of some pretty cool stuff. I got to see some really cool things. I worked on a cool floor where we actually worked with heart transplant patients, which was really cool to see. And then I always knew that I wanted to go back to graduate school so I could focus on public health, which is great. That I've ended up here. And one of the schools that I looked into was BU, and they have such a great program there for public health. So I made my way over here to Boston. And I finished my degree a couple years ago now and stayed ever since. And when I came to Boston, I, worked through my grad school program at a community health center in Dorchester. So I was working as a nurse all through that time. And like I said, I've been that's the foundation of kind of who I am as that's what I bring to my experience and to this job is I always kind of lead with that foot first. That's kind of always going to be the underlying kind of framework that I help to make decisions and everything like that is I'm a nurse and I understand what it's like to be with people in hard times and to help them through that. So now I'm here I moved to Boston, moved to Massachusetts, and now I'm here. I feel like, this has become, the place where I want to, stay because I just love Massachusetts and Boston. And then, so after when COVID came around, I was working in a community health center, and I was actually, doing a lot of the COVID testing myself. So I kind of have a little bit of knowledge about how tough that is and, what that's like to go through. And then I came here and, jumping into the situation we have in Revere and, trying to help out in any way that I can and, contribute to all the good work that has been done already. I will say one thing though, unfortunately, so my family is a big baseball family, but unfortunately, I was raised a Yankee fan, but I know that could be disqualifying. So we won't make a big deal about that. But
you just can't talk baseball. But unfortunately, the Red Sox are just near and dear to our hearts, but they're just doing horrible.
I know, rough year for them. I know.
What are you gonna do?
Yeah.
Now you had mentioned that while you were pretty much a special project nurse with COVID. I mean, you really got involved in it. And since you've come to us during, basically in the last 2 weeks, I've heard you make call upon call, but you've come to us during the second wave of COVID, and our seniors are dealing with this.
Yeah.
Talk to me about, what you saw with people dealing with this, and especially in the senior population.
Yeah. So interestingly enough, what we're seeing here in Revere, we are seeing, across the nation, across the state, we're seeing these numbers go up. in terms of cases. And it's not something that we totally weren't expecting. We thought that maybe because of what we know about COVID and because of the winter months and people are indoors and a lot of the other situational things that happen in the winter, we thought that there might be some increase in cases. And what we're seeing here actually in Revere is that we are seeing an increase in cases, but something that's a little, that's encouraging for us is the senior population is the number of cases aren't really, the increase in cases is not coming from our seniors, which is great. And we don't have as much of a rise in hospitalization that we did in the beginning, which is also a great sign. It means that when people are getting it, they're not necessarily getting as sick, which is a great thing. So right now, this winter I think is going to be, it's going to be a tough winter in terms of we have to buckle down and really just try to continue to follow the guidelines that we've all been trying to follow for these last 6 or 7 months. But what we know from what we're seeing in the numbers is that our Revere seniors are really, they're following our guidelines, they're taking it seriously, and that's exactly what we're asking them to do. And I'd really just, I want to just echo what everyone else is saying, but, we want you to stay the course. We want you to get through this holiday season healthy so we can get you to the next one when, you can see, your family and hopefully your family in person and we're through this. But yeah, we're seeing hopefully good things coming from the senior population in terms of the numbers so far this winter.
So our data is showing that our seniors are listening to the city message. They're wearing their masks, they're social distancing, They're washing their hands, they're doing everything right. What recommendations would you have for the holiday season?
Yeah, it's a great question. We really want to try to encourage, I think the most important thing for Thanksgiving and for the holidays is to keep your circle small. And these holidays, and that's a hard thing. That's a hard thing to do, especially because Thanksgiving and Christmas, these are the holidays where you want to be around your extended family. You want to see people who aren't necessarily living in your house with you. But I'm going to just, I want to encourage you guys to try to keep, to your immediate family, the people that you're living with in your household right now. That's going to be the safest thing to do. If there are things you can do to make sure that your risk is less, if you can't do that, if there are situations where you have to see people outside of your immediate circle, testing is a huge component of that. So we're recommending that everyone that you're going to see go get a test 2 days before Thanksgiving. Not really too much before that, and we don't want to push it too close to Thanksgiving either because we want you to have those results. So we're thinking about 2 days would be a good time frame. And then, you can go into Thanksgiving knowing at least everyone had a negative test going in. Now, that doesn't mean your risk is going to be zero, but it does decrease the risk of having someone that you're going to see who would have COVID, and we want to obviously avoid that. Other tips that I definitely recommend are try to avoid buffet style this year. We don't want to have, we want to make sure that you're limiting your contact, even if you're in the same, in the same gathering place as much as possible. A really good tip that I've heard is, if you do have family members coming in, and again, we really want to try to keep these, the gathering small, but maybe have families sitting in different rooms of the house at different tables. So maybe you're not eating together. And then always we're going to recommend if you're getting together, you guys should be wearing masks in the house unless you're eating. That's going to help too. We really have seen great data about how good masks are as preventative measures. They help you, they help everyone else. At first we thought masks just protected everyone else from you. But now we actually know that masks help protect you from everyone else too. So masks are really, really important. So those are just a few tips. Airflow is a big one. And I know that's hard up here in Boston, up in here in Revere, to get airflow with its, if we're in the winter season, but opening windows while you have people in the house, that's going to be helpful too.
And just to reiterate on the masks, if you need a mask, please call 311. We will get the mask to you. Lauren, talk to me about the reusable masks. They should not be using that again and again. And we're talking about the blue and the white. That's it. Go ahead, Lauren.
Yeah, exactly right, Debbie. So these masks are good to use, but you should not be using them. You should use them for 1 day maximum, and then you should be throwing them out. You should not be using them day after day after day. The reason behind that is these are made of a type of material that if it becomes wet and saturated, it kind of loses its effectiveness. And when you talk, you're producing your mouth produces droplets that can make this a little wet. So this should not be reused more, 1 day use and then get rid of it and use the next one. The masks that are cloth, you can use those for a day and then wash them, and then you can reuse them.
So that's really what you want to do, or we could give you several of those reusable masks. So we want to make sure that if you don't have them, please call us. We will get them to you.
Yes.
The testing we've talked about. The other point, Lauren, I know you and I talked about was we go into these holidays and our seniors, we've told them to, stay away from family, to be safe. But with that comes isolation.
Yeah.
I want you to talk a little bit about that.
Yeah, it's something that, so feeling isolated during this whole pandemic is, I think, how a lot of people are feeling. And the holidays can be hard, even if we're not dealing with COVID. And I think COVID is going to make them just a little bit harder. And I just want all of our seniors out there to know that we feel that for you too. We feel that ourselves, and we're, my heart is with you all. And Debbie and I are going to work on some creative things that I think will try to help get us all through these holidays to make us all feel a little bit more connected. But I just want you guys to know out there, you're not alone. We are in this together. We think there's a light at the end of the tunnel. We hope this is the only, Thanksgiving and Christmas that we have to worry about this pandemic. And there is hope at the end. And so if you're feeling, extra down this holiday season, just know we're thinking of you. We're here. We're going to try our best to get you feeling a little bit more connected to us, to make sure we're feeling connected to you. But it's you're not alone by feeling that. It's out there, and we are with you, and we are hopeful that this is going to be, I think we have a light at the end of the tunnel now, and I can talk a little bit more about why I'm saying that.
Yeah, and that's what I was just going to lead into. And what do you see as light at the end of the tunnel, Lauren?
Yeah, so when we're dealing with a disease like COVID, the thing that's going to make this, the real thing that's going to make this to be able to go back to somewhat normalcy is a vaccine. And I'm sure a lot of you out there have heard on the news recently a little bit more about a vaccine. And what I can say is we're closer than we've ever been in terms of getting a vaccine out there. And I'd love to come back on and chat once we know a little bit more specifics about what it would look like. But I just wanted to kind of get out ahead of it and talk to you a little bit about my thoughts behind some fears that there might be out there behind a vaccine, and kind of why I think this is kind of going to be the light at the end of the tunnel. So first of all, I do want to say, when we get more information, when we get approval from the federal advisory, and when we know that this vaccine is good to go, it's effective, anything that we would be suggesting to you, we feel confident that it has been vetted by the right people, by the right scientists. And, I would never recommend a vaccine that I wouldn't take myself. And it's, this is going to be important. Right now, we're seeing that there's 2 vaccines out there. They're both actually pretty effective, and they're both pretty safe at this point. And so, there's a couple more testing rounds that it has to go through. But, right now, we think the vaccine, at least for the first round, will be going to people who, are over 65. So our seniors might be one of the first groups of people getting this vaccine. And I want to come back on before that happens to let you know how that will happen. But once we get the vaccine out there to to a majority of people, we're going to be able to achieve something that's called herd immunity. And basically what that means is enough of us have had the vaccine that COVID can't spread from one person to another anymore. And so that's when we know that we've kind of reached the end of this, when it doesn't spread from one person to another. And a vaccine is going to be really what does the trick for that. And so it's coming. And, we don't know details yet as to what it would look like in terms of who's giving it and all that stuff. But once we do know that, I'll come back on and chat with you about it, chat with you about potentially the fact that we actually might need to get two doses. It might need to be not just one, but two. And we'll chat about that too. But it's there. I would never recommend something that I wouldn't take myself, and I will have confidence when we get to the point that I can recommend it, that it will be safe and effective and has gone through the right channels.
And you, of course, would be taking that too, correct,
Yep.
Lauren? Because you are, your first line. So you would be taking that vaccine when it comes out as well.
That's right. Yep. So I would be one of the first group to get it as well. And the thing about the vaccines is, this is a new vaccine. Obviously, we've never had a COVID vaccine before, but it's actually using a little bit of a different technology than any other vaccines that we've used in terms of how they make it. But it is in the trials that they're doing, it has been very successful and very safe. And so, like I said, I'm going to be getting it to myself. And so I think it's normal to have a fear maybe of something that's new, but I just want to make sure we all feel confident that it's going to go through the right channels. And I would never recommend something that I didn't feel safe about.
That's great. Thank you so much for addressing that, because I think we do hear a lot about it, but it's normally from, people who are in the hospital and they're in the trial and, but again, I think if it helps one person, that's important.
Yeah.
So Lauren, coming in, I know that we're still dealing with COVID.
Yeah.
And we're being positive and we're talking about getting through the holidays. Now, when someone does test, obviously, and they are positive, we are calling as a city to let them know that they are positive, but we also do something that's called contact tracing.
Yeah.
Could you explain contact tracing to the seniors so they know what to expect when a call comes to them?
Yes, great question. And I'm glad we can talk about this. Contact tracing is something that can be done for any type of infectious disease, but we've all started to hear about it so much because of COVID. And the whole point of contact tracing is to stop the spread of someone we know is positive, to try to contain it to a small circle so it doesn't spread to their extended family, to their extended contacts, to their extended workplace, or anything like that. So contact tracing basically is just someone calling you and asking you some questions about where you've been for the last couple of days, how you're feeling, who's in your house that potentially could be exposed, what they need to do, what you need to do. And there's a couple of different people you could be hearing from if you get a call and you think it might be contact tracing. The state has their own contact tracing team. By the state, I mean Massachusetts has people that they have hired that call when the local communities like Revere don't have the capacity to call everyone in our city. And so we sometimes give them cases is what we call them, but we give names of people who we need to contact to make sure that they're doing okay, to make sure that we've found all the people that they've been in contact with. And so you get a call from the state. You also could get a call from, myself or some of the other nurses that are working in this in the city of Revere, and these amazing school nurses who've been doing this since March. They are just, they're in it as well. And we work every day and we talk through cases and we talk through scenarios and we try to, when we're calling you, we're trying to help you feel comfortable with the process. We're trying to help you, first of all, make sure you're doing okay. If you need advice about anything, we can give that to you. We can also give you resources. The Revere has a lot of resources that we'd be able to, kind of tip you off to and that you might not have heard about before. So we're doing that. overall, contact tracing is, it isn't a scam. It's what's necessary right now. It's helping us contain the spread of this virus as much as possible. And so if you have concerns about when you're getting contacted, if you get contacted, you can always reach out to us. But just know that there's a trained team who knows the right questions to ask, who will be reaching out to you. And the reason we're doing this is just to try to help stop the spread as much as possible. It's not to punish anyone. It's not to shake your finger, nothing like that. Just to make sure we're keeping as many people safe as we can. And in doing that, we want to make sure that we contain the circle of potential contacts to as few as possible.
Perfect. I think that's when they see a strange number, a lot of people will not answer the phone. So when they do contact tracing, I guess this is my question, do they leave a number for them to call back? I believe they do, correct? Yeah.
Yes, they do. Yes. And you're right about that. It's not going to be a number you recognize, and that's okay to let it go through to voicemail and listen to them. And they're going to identify themselves as the contact tracing team, or if we're calling from our local Board of Health, we identify ourselves as the Revere Board of Health. So you would hear that on a voicemail.
Okay, perfect. So they should definitely call back with your questions. This is what these people are for. And let me tell you something. I have watched Lauren work diligently for the past 3 weeks, a month. Is it a month yet, Lauren? Yeah, it is. Okay, a month. It is a month. And she's young, she's energetic, she's positive, but more than anything else, she's intelligent. And I've watched her work, and we are so lucky to have her. We are really, really lucky to have her, to all my seniors. And I know you're going to meet her eventually, and you're going to love her. And I know you're very sad when Carol left. And there was some big shoes to fill, really big shoes to fill. But I think Lauren is coming very close to filling those shoes, because she, I'm telling you, I've watched her, and again, positive, intelligent. So if you guys have any questions, or you can call Director of Public Health, you can call the Senior Center. We will get you in touch with Lauren if you have some questions for her. So I guess what my next question is, Lauren, is, again, you've been here for a month. What would your message be, just this early stage? What would your message be to our seniors, if anything?
Yeah, well, I think long term, I envision this public health department here at Revere, once we get past COVID, to be able to really focus on the types of, when you talk about public health, there's a lot of different things that go into it. There's people's physical health, their health, their medical conditions. There's mental health, that makes sure that has a lot to do with the isolation that we're talking about right now. And there's also, the community that we live in, and the roads that we drive on, and the grocery stores we go to, and the beach, and all that stuff. So all of that goes into public health. And kind of when I think about where I want to, where I'd love to help, in the future, and where I want to go. And I just, we want to obviously make Revere as healthy as possible. Like I said, I'm a nurse, so I'm always in the business of trying to, keep people healthy. And I think that, and our seniors too, we want to make our seniors happy and happy and healthy, and a lot goes into that. And I think I'm just really looking forward to being able to work with a lot of the organizations, the institutions that we have already in Revere, in order to build on that, and to just make sure that we continue the good work of keeping people healthy here in the city. And I think we really have the ability to do that. So I just say, I'm just as honored to be here. I feel so grateful that I was able to take on this role. And I mean, in my month of being here, I just can't tell you how welcomed I felt, and how, it's not every day you come across a place where people have so much pride of where they're from, but also have just, they want to work to make this city as great as it can be, and as great as it is. And that's a really special thing. And I don't take that for granted at all. And I'm just so excited to be here. And hopefully I'll have a long relationship with everyone here, and just become folded into the fabric of Revere. That's my wish.
Well, it's my wish too, Lauren. And once everybody meets you, I'm sure it's going to be their wish too. I thank you for coming on and meeting our seniors. Thank you again.
Thank you.
Okay, and for the senior FYI, remember everybody, stay happy, stay healthy.